This is Dr. Stephen Rath with Fusion Medical Spa in Ruidoso, New Mexico. On Fridays, sometimes we close the office early and catch up on paperwork. Sometimes we catch up on hair, and that's what we're going to be doing today. I have 3 younger brothers, all of whom have less hair than I do. I started doing platelet-rich plasma therapy about 3 years ago, and now we're stepping up the game to actually work on not only stopping my hairline from receding, but we're going to work on it proceeding with a combination of platelet-rich plasma injections, a nice Glytone hair restoration line, and some laser resurfacing to stimulate new follicles. This is going to be a very short video, and it's going to cover what we do for hair restoration. One of the terms that's used is vampire hair restoration. We used topical numbing cream that I had on for about an hour prior. About 10 minutes ago, I had my scalp injected with lidocaine, and now Dr. Carrie Rath, my wife, and my daughter Lee are going to inject platelet-rich plasma into my scalp. So I will we'll see how good the local anesthetic was, and I'll try to keep from screaming.
One second, let me cut the area.
So apparently we've done a good job with the numbing. I'm feeling kind of a weird sensation against my scalp, but there's absolutely zero pain right now. So we have to credit April, also our videographer, for an excellent job numbing my scalp. The scalp is considered one of the vessel-rich groups. So what that means is it's prone to bleeding. So when you stick a needle in, whether you're injecting numbing or platelet-rich plasma, there's always a tendency for a little bit of oozing. And so Lee's being very good with picking up any ooze. And that was the last of the first syringe. So that's half of the procedure. We're going to go around to the other side and do the second half of the procedure. First half thus far was 100% painless. So why am I spending my Friday afternoon doing this vampire hair restoration procedure?
By letting your wife put a needle in your head.
By letting my wife put a needle in my head. It's not just because she enjoys sticking me from time to time. I am not, I've looked at all the other methods for hair restoration, and other methods for hair restoration, you're actually, it's a negative net result when they take whether they take a piece of your skin and then pull hair plugs out and reinsert them, or whether they do a neografting procedure where they use a robot to harvest the little plugs. Not all of the plugs survive, and so you're moving hair from one area into another, but the net result is you actually have fewer hair follicles than you did at the start. My goal is to not only preserve the number of hair follicles that I have, but to also regenerate, rejuvenate the follicles that are that I was born with, that went dormant during the aging process. And that's one of the things that platelet-rich plasma does, and stem cell therapy does as well.
All done. All of this, you want to do anything?
Actually, that one's done.
Is it still oozing?
No.
Maybe you should just
Okay.
massage this a little bit.
So they're going to massage the platelet-rich plasma in to my scalp. We're going to finish up the procedure after the video is camera's off with a little bit of laser resurfacing to the scalp area that's going to stimulate new hair growth. It's going to actually damage the follicles, and with the platelet-rich plasma that we injected, they have the ability to come back and actually participate in an active hair growth cycle. We always do hair restoration procedures in combination with a hairline. We use the Glytone hairline. It includes minoxidil or Rogaine, a shampoo, a conditioner, an oral supplement, and a serum that I put on my scalp actually twice a day. So, Dr. Stephen Rath and I have just had a vampire hair restoration procedure on a Friday afternoon. Thank you.